As an ethicist, I've dealt with many issues over the course of my career, but I will tell you none even close to this in the level of importance, in the level of outrage that it's produced in me, and fundamentally, the first time in my life it has motivated me to progress from scholarship to activism. And I've never been an activist. Even this crazy election hasn't mobilized the activist in me, but this has. I have begun a number of talks and meetings around the country to both condemn what is going on overseas and to anticipate before it gets here, to try to prevent it from the camel from getting under the tent, because it will come. The fact of the matter is we now have a metastasizing number of physician-assisted suicide laws. Legislators are already beginning to discuss the question, well, if we give it to people who are terminally ill, what about people with ALS and dementia and multiple sclerosis? So the slope is slipping. As even in the US, we're gradually beginning to talk about widening the scope, and it will, the accelerant to that slip, is many of the tropes that we hold sacred, like parity and non-discrimination and anti-stigma, and the messages that we've been giving up. We really shouldn't be treating psychiatric patients any different than any other medical patient, which is so true, but that argument will be the Trojan horse inside of which this trend is coming. I'm also a member of the Assembly of the American Psychiatric Association, which is kind of like the Congress. And in this assembly, you can introduce an action paper, which is kind of like a bill. And the action paper that I introduced, along with my colleague Annette Hansen, who is the head of the forensic psychiatry residency at University of Maryland, we introduced an action paper. And the action paper instructs the board of directors to take a stand to say that a psychiatrist should not kill their patient, that a psychiatrist should not administer lethal care for a non-terminally ill patient for the purpose of causing death. So this action paper that I made with, put on the floor with Dr. Hansen, that directs the board of directors to make this policy statement, this position statement to the world, passed yesterday unanimously, without a single objection from the floor of several hundred psychiatrists. And that in itself is a feat, because there's almost nothing you can get several hundred psychiatrists to uniformly agree on without somebody standing up and trying to, talk the counterpoint, which did not happen. So I feel, very pleased and proud that my organization saw that this issue fundamentally is a no-brainer. No other world psychiatric body has spelled this out so explicitly. The World Psychiatric Association, to which Belgium and the Netherlands belong, has made some vague statement like you should be careful and you should make sure the patient has access to all the care that he or she needs, but they have not come out to explicitly condemn it. You know that there's a dark legacy and history in Europe when it comes to euthanasia and psychiatric patients. These were the first to go in Nazi Germany, and in pre-war, the T4 office, began to identify them as life unworthy of life. That was involuntary, but there's still that kind of lingering odor over there. And so the World Psychiatric Association has not actually been coming down in any kind of a strong, firm way on these member countries. The Australia and New Zealand Psychiatric Association has said it very firmly. This is not ethical. The Canadian Psychiatric Association has not. Even now, Parliament 2 months ago recommended that to fulfill the Supreme Court's dictum that we need a law to make physician-assisted suicide available, this committee who studied it in Parliament recommended that mentally ill people who are not terminally ill be allowed access to physician-assisted suicide. Fortunately, the brand new, young and sexy Mr. Trudeau came out and said, look, we want to make this accessible, but my administration does not support it for the mentally ill, which I think is very good. As soon as the board of directors makes this official, the American Psychiatric Association, the largest body of organized psychiatry in the world and the most powerful body, the inventor and producer of the DSM, will say to the world, psychiatrists shouldn't be doing this. And that will both send the message overseas where it needs to be heard loud and clear, and it will anticipate what I have called an impending ethics tsunami that's coming to these shores.